Have you ever wondered how something so vital to your survival could begin to fail without making a sound? That's the story of the liver, an organ that performs over 500 essential functions, working around the clock to clean your blood, digest your food, store your energy, and protect you from the toxins you don't even realize you're exposed to. And yet, it does all of this silently. Until it can't. Liver disease doesn't usually strike like lightning. It creeps in, quietly, gradually, often without pain. It doesn't scream for help. It sends signals in whispers, strange sensations, unexplained changes in your body, or symptoms that seem unrelated, until they're not. The scary part? By the time most people recognize something is wrong with their liver, the damage has already reached an advanced stage. But it doesn't have to be that way. The key is learning to recognize the early signs, the small clues your body gives you when your liver is struggling to keep up. In this video, we're going to help you become the kind of person who doesn't wait for a crisis. Who listens? Who acts early? Because when it comes to your liver, awareness isn't just knowledge, it's power. And it might just save your life. 1. Changes in stool color. Under normal circumstances, your stool gets its rich brown color from bile, a vital digestive fluid produced by the liver to help break down fats and remove waste. But when your liver becomes sluggish, inflamed, or burdened by fatty liver disease, bile production or flow can decrease significantly. As a result, your stool may appear unusually light, sometimes even grayish or clay-colored. This color change is more than cosmetic, it's a signal that bile isn't reaching your intestines in the right amount or at the right time. And since bile also plays a key role in breaking down fats, you might also notice that your stool is greasy, unusually soft, or even floating in the toilet bowl. Floating stool may sound harmless, but it often indicates fat malabsorption, another clue that your liver and digestive system are under strain. If this continues for more than a few days, don't assume it's just a dietary fluke. Persistent pale or floating stools can be linked to conditions like bile duct obstruction, hepatitis, or early-stage cirrhosis. The earlier you act, the better your chances of reversing the damage. So if your bathroom habits are telling a new story, it might be time to listen. Your liver could be speaking through your stool. 2. Difficulty seeing in the dark. While it's easy to blame aging eyes or needing new glasses, few people realize that poor night vision can actually be a warning sign from your liver. That's because your liver plays a crucial role in processing, storing, and delivering vitamin A, the nutrient your eyes rely on to adjust to darkness. When the liver is compromised, due to fatty liver, inflammation, or other damage, it can interfere with the metabolism and transport of vitamin A. Without enough of this vitamin reaching your retina, your eyes struggle to adapt in low light conditions. You may notice it's becoming harder to drive at night, to walk safely through dim rooms, or even to read your phone in bed without straining. This isn't just a minor annoyance, it's your liver quietly waving a red flag. If you've ruled out eye disease and still find it difficult to see clearly in the dark, don't ignore the possibility of liver dysfunction. Sometimes, the first signs of internal imbalance show up in the most unexpected ways, like the moment the sun goes down and your vision can't keep up. Your eyes may be telling the truth, but it's your liver that needs attention. 3. Swelling in your legs or ankles. This type of swelling, known as peripheral edema, doesn't usually start with pain. It sneaks in quietly. Maybe you notice your socks leaving deeper marks, or your shoes feeling tighter by evening. Over time, it becomes more visible and persistent. So, what does your liver have to do with swollen feet? Quite a lot. A healthy liver produces a vital protein called albumin, which helps keep fluids inside your blood vessels where they belong. But when the liver is damaged, Due to fatty liver, hepatitis, or cirrhosis, it may no longer make enough albumin. Without this protein, fluids begin to leak out of your vessels and collect in nearby tissues, especially in the lower parts of your body where gravity pulls fluids downward. This is why you might see puffiness in your ankles or feet, often worse on the right side, due to how blood returns to the heart and how the liver is positioned anatomically. Many people dismiss this kind of swelling as simple fatigue or age-related circulation, but persistent edema can be one of the earliest outward signs of liver dysfunction. And if left unaddressed, the swelling can worsen and even lead to more serious complications like skin breakdown, infection, or reduced mobility. If you're noticing that your lower legs feel heavy, tight, or swollen, particularly by the end of the day, it's not something to brush off. Don't assume it's just your shoes or a hot day. Your liver might be struggling to maintain balance, and this visible symptom could be your first chance to catch the problem early. Listen to your body. Your feet may be trying to tell you something your liver can't say out loud. Before we move on to the next sign, if you're finding this video helpful, don't forget to share it with someone you care about and hit that subscribe button so you never miss our latest health tips. 4. White or yellow bumps around eyes. Small white or yellowish bumps around your eyes may look harmless, but they could be one of the earliest visual signs that your liver is under stress. These subtle patches, known as xanthelasma, often show up near the inner corners of the eyelids or just beneath the brow line. They don't hurt. They don't itch. And that's exactly why most people ignore them, thinking they're just age spots or minor skin growths. But what these bumps really represent is a buildup of cholesterol deposits beneath the skin, especially when the body can no longer process fats efficiently. And here's where your liver comes into the picture. One of the liver's many responsibilities is to help break down and eliminate excess cholesterol from the bloodstream. When the liver becomes sluggish, overloaded with fat, or inflamed, this system begins to fail. The result? Cholesterol starts to collect in places it shouldn't, like the soft tissues around your eyes. Why the eyes? Because the skin in this area is thinner and more vascular, making it easier for fatty compounds to settle and become visible. And while xanthelasma doesn't pose a direct threat on its own, it often accompanies underlying metabolic problems like fatty liver disease, high LDL cholesterol, or insulin resistance, all of which, if ignored, can increase your risk of cardiovascular disease. So, if you've noticed small, flat, pale yellow or white patches forming near your eyelids, don't dismiss them as cosmetic quirks. Your skin might be showing what your liver can't say out loud. It's a gentle but urgent whisper, pay attention. Something deeper could be going on. 5. Heaviness under right rib after meals. This particular discomfort is often overlooked or brushed off as bloating, gas, or simply eating too much. But when it becomes a recurring sensation, especially if it's accompanied by pressure, fullness, or mild pain, your liver might be the organ trying to get your attention. Located just beneath your right rib cage, the liver works in close coordination with the gallbladder and bile ducts to produce and secrete bile, a crucial fluid for digesting fats. But when your liver is overworked, inflamed, or impaired by conditions like fatty liver disease, the bile it produces can become thick and sluggish. This thickened bile may struggle to flow properly through the bile ducts, causing back pressure and minor blockages that build up just beneath the rib cage. As this pressure increases, it can also irritate the phrenic nerve, a nerve that runs from your abdomen up to your neck and shoulder area. That's why some people feel not just heaviness in the side, but even aching or tension that radiates up to the right shoulder or neck, often without realizing it's liver-related at all. Over time, this subtle symptom can become a daily nuisance, especially after meals rich in fats or oils, when the liver is forced to work harder. If you consistently feel like something is off or weighted beneath your right ribs, don't ignore it or keep blaming your digestion. Sometimes, your liver sends quiet signals long before blood tests do. Listening early could make all the difference in catching and reversing liver damage before it becomes serious. 6. Red or purple spots on your skin. These tiny dots, known as petechiae or purpura, often appear on the arms, legs, or torso and may seem harmless at first glance. But in many cases, they're silent messengers from within, warning you that your liver's ability to manage your blood is starting to fail. Your liver plays a central role in blood clotting by producing crucial proteins, including fibrinogen, which helps seal tiny breaks in your blood vessels. When the liver becomes inflamed, fatty, or scarred, it may no longer generate enough of these clotting factors. As a result, even the smallest pressure or impact on your skin can cause capillaries to burst, leading to scattered red or purple spots, or bruises that appear without explanation. These spots can also signal low platelet levels or elevated pressure in the veins due to impaired liver function, a combination that puts your circulatory system under intense stress. It's your skin reflecting what's happening beneath the surface. So if you're noticing patches of redness, pinpoint-sized purple dots, or bruising that seems to show up out of nowhere, don't chalk it up to aging or thin skin. Your liver may be losing its ability to protect your blood vessels. Catching this symptom early could be the key to uncovering deeper liver issues before they escalate into something far more serious. 7. Cracked, dry heels. Most people assume dry heels are caused by walking barefoot, wearing sandals, or dry air. And while those things can certainly play a role, there's another cause few people consider: internal nutrient redirection driven by liver stress. When your liver is damaged, whether from fatty buildup, inflammation, or chemical overload, it immediately begins repair mode. One of the key nutrients it draws upon for self-healing is vitamin B3, also known as niacin. This vitamin supports tissue regeneration, enzyme activity, and detoxification processes inside the liver. But here's the catch: if your liver is in constant need of niacin, your body may start diverting that resource away from other areas, like your skin. Areas of your skin that experience regular friction and pressure, like the heels of your feet, become especially prone to dryness, flaking, and painful cracking. Even regular moisturizing may not be enough to fix the problem, because the issue starts from within. So, if you've been battling stubbornly cracked heels despite using creams, balms, or exfoliators, consider looking deeper. It may not be your footwear. It might be your liver demanding support. Sometimes, the smallest cracks on your skin are trying to reveal much larger cracks in your internal health. 8. Pale or clubbed fingernails. One of the most telling signs is pale or white fingernails, which may reflect reduced blood flow, poor oxygenation, or even anemia, all of which can occur when the liver is no longer producing enough proteins and hormones essential for red blood cell health. In severe cases, the nail beds lose their pinkish tone entirely, creating a ghost-like, bleached appearance. Another major indicator is a condition called nail clubbing, where the fingertips become swollen, and the nails begin to curve downward around the tip like a rounded dome. This change is often gradual and painless, which makes it easy to ignore. But in the context of liver disease, especially cirrhosis or long-term liver scarring, it can be a red flag that your blood isn't being properly oxygenated or circulated. That's because liver dysfunction can indirectly affect how much oxygen reaches your peripheral tissues, including your fingers. A now famous study from the 1950s found that as many as 80% of patients with cirrhosis had pale or completely white nails. Even decades later, this observation holds clinical value. If you're noticing these types of changes, especially alongside other symptoms on this list, don't just dismiss them as cosmetic or age-related quirks. Your fingernails are part of your body's communication system. When they start to look unfamiliar, it could be your liver quietly pleading for help. 9. Persistent itching. While it's easy to blame dry weather, allergies, or soap, itching that becomes chronic, worsens at night, or isn't relieved by moisturizers deserves a second look, particularly if you've noticed other liver-related symptoms. When your liver isn't functioning properly, one of its most overlooked failures is its inability to efficiently remove bile acids from the bloodstream. These acids, meant to aid digestion, can build up and seep into your skin's tissues, triggering nerve endings and creating a deep, relentless itch. It's not just a surface sensation. It often feels internal, like something is crawling under the skin. At the same time, impaired liver detoxification can lead to elevated levels of histamine, a compound that further amplifies the sensation of itching. The result is an itch that often becomes more intense at night, disturbs sleep, and seems resistant to creams, antihistamines, or scratching. This kind of itching tends to affect the palms of the hands, soles of the feet, arms, and back, though it can occur anywhere. And while it may appear alone at first, it's often a precursor to more obvious liver symptoms like jaundice or dark urine. If you've been living with unexplained itching that just won't go away, don't dismiss it. Your skin could be signaling a toxin buildup that your liver can no longer manage. The sooner you get it checked, the sooner you can uncover what's really going on beneath the surface. 10. Dark urine. If your urine suddenly turns dark yellow, tea-colored, or even brown, it's time to pay close attention. While dehydration can cause temporary darkening, a deeper, persistent shift in color could indicate something more serious: your liver struggling to remove bilirubin. Bilirubin is a yellow compound produced when red blood cells break down. Under healthy conditions, your liver filters it from your blood and sends it out through bile and urine. But if the liver becomes inflamed, scarred, or overburdened, due to hepatitis, cirrhosis, or other liver diseases, bilirubin starts leaking into the bloodstream and is excreted in large amounts through your urine, staining it a dark amber or brown. What's dangerous is that this sign often appears before pain or other symptoms. It's one of the liver's earliest calls for help. So if your urine stays dark despite drinking enough water, and especially if it's paired with fatigue, nausea, or pale stools, don't ignore it. Your liver might already be under significant stress. 11. Jaundice. You may first notice a subtle yellow tint in the whites of your eyes, then in your skin or even your gums. This discoloration is caused by excess bilirubin building up in the blood, a direct result of the liver's failure to properly process and excrete it. Jaundice isn't a disease, it's a visible symptom of something deeper, often tied to fatty liver disease, hepatitis, or bile duct obstruction. When the liver becomes overloaded or inflamed, it can no longer keep up with filtering out waste and toxins. The excess bilirubin turns the skin yellow, and in severe cases, even itchy or sensitive to sunlight. This symptom is impossible to ignore, and you shouldn't try to. If someone you know appears visibly yellow, it's not just fatigue or diet, it's your liver waving a bright, urgent flag. Seek medical evaluation immediately, because this is when early intervention can make all the difference. 12. Spider-like blood vessels. These tiny clusters of blood vessels usually appear just under the surface of the skin, and resemble red, blue, or purple spider webs, most often on the face, upper chest, arms, or legs. They form when the liver can no longer regulate estrogen levels in the bloodstream. This hormone imbalance causes small capillaries to dilate and become visible, especially in thinner-skinned areas. Though these marks are painless, they're often seen in people with chronic liver conditions, including hepatitis and cirrhosis. Many people dismiss them as broken capillaries or age-related skin changes, but their symmetrical and clustered nature is a clue worth paying attention to. The presence of multiple spider angiomas could mean your liver is no longer efficiently filtering hormones and toxins. If you start to notice more of these clusters, especially alongside fatigue or other liver signs, it's time to take your liver health seriously. Your liver has protected you every second of your life. It handled the stress, the toxins, the late nights, the poor meals, the medications, the sugar, the alcohol, without ever asking for thanks. But now, it might be asking for your attention. The truth is, you don't need to be perfect to have a healthy liver. You just need to be present. Pay attention to the signals, take them seriously, and give your body the support it needs. Because the earlier you act, the more reversible the damage becomes. And the more hope you have for a future free from fatigue, pain, or disease. So if today's video helped you see your health from a new perspective, don't stop here. Share this message with someone you care about. Help them protect the most underrated organ in their body. And make sure to subscribe to our channel for weekly content that puts science, prevention, and real answers in your hands. Together, let's stop silent illnesses before they steal years from our lives. Let's build a healthier future, one informed choice at a time. And it starts with you. Right now.